couldn't walk even a block without getting bad sciatica. It hurt to get up and out of chairs. I just felt my life just contracting. And I started yoga, and then I went to Feldenkrais, and I go, this is really where it's at.
I've been suffering with chronic pain for over 8 years. The neck problem was restricted movement. I've been diagnosed with thoracic outlet syndrome bilaterally. I've tried medications, which haven't helped. I've tried epidurals, which haven't helped. I've tried, I forget the name, where they burn the nerves to destroy them. That didn't help. Physical therapy doesn't help. Yoga flares me up. Exercise flares me up. I used to work, can't work anymore. Disability for a while. And I also have an unstable pelvis and get sciatica and pain all the way down my leg from walking or sitting. So I'm a mess. And read about Feldenkrais in a back pain book, and I'm so glad to be here.
Oh, we're so glad you're
Can
here.
I ask what is Feldenkrais?
So typically I actually explain Feldenkrais as we're going along, but Feldenkrais is named after a guy named Moshe Feldenkrais, who was alive from 1904 to 1984. Okay, so now I would like everybody to write their name on this piece of paper. I need a pen. Sorry, I don't. Oh, you need a pen, and you need too. Okay, yeah. So sorry, I don't have anything for you to write underneath.
You guys didn't come to class.
Yeah, I mean, I was originally thinking like this would be great with chairs, yet I didn't think we had enough chairs for everybody. So, you know, we're simulating what you're doing at work, writing and, you know, doing desk work. And now I want you to ask yourself the question, where do I write from? As in, what part of my body am I writing from? So I want you to go ahead and write. Again, this paper is just for you, so don't worry about, you know, anybody else seeing it and caring about what you write. But I want you to go ahead and write the question, where do I write from? And your first answer might be the fingers, the wrist, but I want you to actually really listen to what parts of your body are involved as you write. And just continue writing to get the information, and I want you to start to listen in words, to listen to how much muscle effort you're using in your arm, in your shoulder, as you write. And notice how tightly you're holding the pen or pencil. And let's just pretend like we're there at our desk, and you know, for those of you who are computer users, and for those who aren't, just pretend that there's a computer out in front of you. And set your arms how you would on the computer. And go ahead and type. Actually, show us the way you type. And as you're typing, actually you can envision, actually go to that place. If you work in an office, just go there right now in your memory. Because sometimes when we're in certain office spaces, we tend to like inhibit our breath more than like we would in a yoga studio. We have different emotional memory associated with it. So see what areas of your shoulder or any part of your body that are holding on more than they need to. A lot of people have the tendency to raise up their shoulders, so just notice if you do that as you're typing. And I'd like you to just type with your dominant hand, whatever hand you wrote with. And I want you to type really small. And I want you to listen for what part of your body you use to type with. And I want you to listen for what all the other fingers are doing. And I'm just kind of looking around the room and taking mental note right now. Okay, and then go ahead and stop. So you can put your piece of paper in your pen to the side. At the very end, I'll have you write again and see if anything feels different. But you don't need it otherwise. Okay, so clear out that space. So I'm going to actually have you lay on your back with a bolster under your knees. So let's. And notice if your breath is in your chest region. And you can notice this by the movement that occurs, specifically in the ribs. As you breathe, do you feel your ribs expand and then contract towards one another once again? Notice your rhythm. And notice if you have any breath on your back side of you, underneath you. Feel if you can feel your two floating ribs underneath your back moving with your breath. Also, as we focus on our breath, it calms your nervous system to bring you into a more, let's say, a suggestible state. Because Feldenkrais works directly with your nervous system. So we begin every lesson by doing a body scan. To notice how the floor is coming up to meet our body. So let's start this body scan from the back of our head. So notice what parts of the back of your head are making contact with the floor. Oh, and if you have glasses on, let's take those off there. I'll put them over here. And then draw a line as if someone was taking their index finger and drawing a line down the back of your spine. And notice at what point your spine lifts from the floor. And continue drawing that imaginary line with your index finger. And see vertebra by vertebra how the spine lifts off of the floor. Like which vertebra is the highest. And you might not also notice that that your neck or your vertebra is angled more to the right or more to the left. Keep traveling in your imagination that line down to the base of your neck. Notice what part of your neck is the highest off the ground. And then notice at what point your back of your neck meets the floor, meets the shoulders. And also notice if your nose is veering more to the right side or to the left side. Which way are your eyes veering? More to the right or to the left, or are they in the middle? For most people, there is a preference. And oftentimes, that preference is correlated with your dominant hand. Whichever side you access the world more frequently. So for me, with my right hand dominance and my right eye dominance, my face and my eyes and my neck are usually veering more to the right. Which that alone creates an asymmetry for me. Nothing's wrong with it, just something to notice. So continue the investigation of your spine, traveling that line down between your shoulder blade region. And as you do, you can notice, are your shoulders even on the floor? Or is one side heavier in contact with the floor than the other? And does the area between your shoulder blades, does it touch the ground or not? And is there movement in this area between your shoulder blades? And does one side of your chest breathe more fully than the other side? Like, is there more space in that cavity than on the other side? Also notice how high your shoulders are lifted from the floor, as if I was going to come above you and slip my hands under your shoulders. Would I be able to slip my hand further on the right side or the left, or are they about even? And let's go ahead and travel down our spine in our imagination, noticing your mid-back, What parts of your mid-back are touching the ground? What parts are lifted from the ground? And what parts are the heaviest in contact with the ground? And how about your low back? Same thing. Is one side of your low back heavier from the ground? How high is that space off the ground? And then notice your pelvis, your pelvic region. Is one side of your pelvis heavier to the ground? Are they even, or is it one side is more in contact with the ground, the other one is lighter to the ground? And once again, notice the ribs on each side. Does one side expand more with each breath than the other, or are they about even? So we're quieting our listening skills, hone in our attention to our internal world of sensation. So now let's take a moment to notice how our arms are making contact with the ground. Notice how heavy your upper arm is in contact with the ground, both of them. And how about your forearm? How heavy towards the ground is it? Or is there a space when it comes down to the wrist area, space between the floor and the air? And how are your fingers lying right now? Are your fingers straight, or is there a slight curve in your fingers? We have 3 joints in each of our fingers. Sometimes we forget to use these joints. And very gently roll your head once to the right, staying in your range of ease and comfort. Come back to the center, and then roll it once to the left, staying in the range of ease and comfort. And notice which side you roll easier to. So this will be our reference point, something we'll keep coming back to and checking how your neck rotation is. So we're going to focus now on our dominant hand. This is the hand we're choosing to work with. So for most of you, it's your right hand. If I accidentally say left and you're working on the right, then, or vice versa, just pardon me in advance. So place your right palm downwards. And if you want to, you could place the blanket underneath just to give you more sensory awareness of this area. So your right palm, or whatever palm you're working with, is facing downwards, and it's making contact with the floor. So before we begin, just notice what the space is inside of the hand. Is the space curled or C-shaped? Or is the palm flat? Now, it might also be good to notice where in your body you're holding tension. Are you holding tension in your fingers? Are you holding tension in your shoulders? Are you holding tension in your jaw? For most of us, we actually are, we're just unaware of it, and we don't actually know, we don't have the resources to know how to let go, even if we are. So what I'd like you to do is first figure out which finger is your index finger. And with the tip of your dominant index finger, just the very tip, I'm going to have you do a very small movement of the very tip of the finger. And I want you to do this with the tip of the finger staying in contact with the blanket or the floor. And going very small, 1 centimeter forward and 1 centimeter away. So it's a tiny, tiny, tiny movement. So back and forth, do this several times. And I want you to do this with the mindset of being a little kid trying to figure out what the sensation is of the ground or of the blanket. So stay very small, very, very small. And I want you to try to isolate this movement just to the index finger. So small. If you do it fast, I promise you, you will fatigue and then have a overuse injury when you leave here. So go very, very, very small. So small that you could isolate this movement just to this finger. And what I want you to think about as you're doing this movement is what parts of myself are involved with this motion. So we're starting very small. Forward and back. 1 centimeter forward and back, just a tiny bit. Forward and back. Very, very, very small and slow. So one of the goals in Feldenkrais is to do the least amount of work possible. So it's an exploration to see what parts of you can help you take the work off, whatever we're doing. In other words, it's noticing what parts of ourselves we may habitually be overusing that we don't necessarily need to use. So I see lots of people moving different fingers. So once again, just the index finger, going very tiny, tiny bit forward and back. And as you're doing this, pay attention now to what the sensation feels like underneath the finger. This is actually one of the best things you can do if you're having numbness. This is the way to awaken your sensation. And as we awaken our sensation in our different parts of ourselves, we actually awaken our brain maps to the awareness of this part. So we clarify that individual part of our body in our brain, which will then improve our movement with like coordination and dexterous kind of activities. You'll have a more intelligent way of moving your hand after this lesson. So just pause with your index finger, take a breath. Okay. Now everybody pause. Now one thing I noticed when everybody was doing the writing exercise, about 75% of you were hyperextending one or more of your fingers. I call it the Buckingham Palace syndrome, when people hold their pinky up like that when they're writing or typing. You get a visual of what I'm talking about. Okay, so this is a habit I see in most of my patients, actually, most of my overuse computer user patients. And so we need to retrain ourselves. It's actually crucial. I'm actually starting to train more and more, like encourage more and more occupational therapists to teach their clients to avoid hyperextending their finger as they're doing repetitive tasks, such as writing and typing. So let's go to the next finger, which is the middle finger. And we're going to do the same thing with the middle finger. So make sure you have the contact of that middle finger with the ground. And very slowly, just take the middle finger 1 centimeter away and 1 centimeter back towards yourself. I mean, this is very small. Dude, it's so small that I can hardly tell that you're moving. For most of us, it's actually challenging and difficult for us to move such a small range. Everybody who starts off with Feldenkrais always thinks this isn't doing anything. It's so and I get it, because I used to be one of those harder is better kind of philosophy people. We had the gym, work out harder. That's something that was programmed into me from my father, who had a type A work ethic. And so it took me many years to change my perspective around that. So now you're all doing really good. Making a very small movement of that middle finger, going very small forward and back. And if you want to make it now 2 centimeters forward and back, that's fine, as long as you're able to isolate the movement to just that one finger. And I want you to ask yourself, how much of my arm is involved with this movement of this middle finger? Is it just the finger, or are there other parts of me that actually need to move when I slide my third finger away and towards? What happens to the shape of my palm? Does the shape of the palm change at all? And how's your breathing? Now, sometimes when we learn a new motor task, like when I give instructions for something novel or new that you've never done before, our tendency is to halt our breath just momentarily. So I invite you to try to do all the movements today without that reflexive halting of your breath. And you can take a break anytime you want for any step. So what we're doing here is we're figuring out how to move ourselves in a way that feels more inviting, more graceful, effortless, and free. Okay, pause. Now find your ring finger. Figure out which one's your ring finger. And with the very tip of your ring finger, this is going to be a little bit harder than the other two. Keep the tip of the finger in contact with the ground underneath, and very small, slide it away from your palm and then back towards. So see if you have the tendency to lift that finger off of your towel or blanket. And if you do, then it just means you need to go smaller. And also as an option, you can actually just think through the motion. Like if you're doing it and you find that you still are putting too much effort into it, the finger still wants to lift off the ground, then think through the motion 4 or 5 times. Just thinking through the motion will actually reprogram our motor cortex. It has an effect on the nervous system, just thinking through the motion. And that's true for any part of today. If you find you're doing more effort, then just think through it. This is about quality as opposed to quantity. And if you're doing it nice and smoothly with the ring finger, go ahead and make it a little bit bigger. And as you make it a little bit bigger, notice what happens to the arches of the hand. We have 3 arches in our hand. And they all change shapes. They all change shapes when we go to do a task, such as anything we do at the desk. You know, most mice, like computer mice, are actually too small for your hand. Okay, take a rest. Everybody just take a rest. That's why I highly recommend ergonomic mice for pretty much everybody. And ironically, the mice that comes with the Macs, you know, that you get like the Mac laptops, those are actually the worst. I mean, they aren't contoured at all to the shape of the hand. So you want to, if you're in the market to buy a mouse, you want to buy one that fits the shape of your hand. So that means that the index finger is a little bit higher than the pinky. Or a lot of people like vertical mice. People with wider shoulder, broader shoulders, I often recommend vertical mice, and a lot of men. So this lesson is a good one to help you to regain these natural arches of your hand, because a lot of people, when they get into that habit of typing with their fingers straight, of hyperextending their fingers, they lose the natural arches of their hand. So it's hard to regain that habit of keeping the C shape in your hand and avoiding the hyperextending without having the good arch inside your hand. Okay, so now let's go to the pinky. So pinky, pinky, same thing, very small. Let's start 1 centimeter, so let's start really small, forward and back. And I know you're doing it all really well when I see your breathing being really full, which I just actually saw everybody I looked at just took a really deep breath right there. That means you're doing something right. Pinky, very small. Now the pinky, the hand moves a little bit differently with the pinky. You might notice that it kind of rotates a little bit. That rotation is called supination, when the palm turns upward, and pronation, when the palm turns downwards. So notice what happens if it just has the slightest tendency to rotate the arm as you slide the pinky just ever so slightly away from you and back towards, but staying really small and slow. Very small. As you bring the pinky in the direction towards your palm, notice if your palm lifts just ever so slightly away from the ground. And as you slide the pinky away, notice if the arches flatten just ever so slightly. So go slower. You especially go slower. So that's how you go slower. So I'm gonna, for some of you, I'm gonna come around and I'm just gonna actually do it for you. So that will allow you to actually feel it. Especially when we get arthritis and stuff in our hands, we basically forget how to use our hands in a more easy, effortless manner. That's all the effort you need. Forward and back. Good. Yep. Just that. So don't go any bigger. Stay that small. Okay, and if you have it really smooth, you can go a little bit bigger with the pinky. A little bit bigger, making the movement away from your palm and back towards your palm. Okay, take a pause and notice how much, if you have any tension in your hand that you're working with. Notice if there's any area of your hand that is starting to release more. And for some of you, I see your hand still a little bit flat towards the ground, and I'm wondering if you're using any muscle effort to kind of flatten it like that, or if it's in its true resting position. The reason why so many people have overuse and repetitive strain injuries right now is because our bodies aren't resting properly. Even when we go to sleep and get 8 hours, for most people don't get 8 hours. Even when we go to sleep and get like even our 5 or 6 hours of sleep, it's not high quality sleep. And the reason why is because our muscles are still contracting even when we're sleeping. Isn't that crazy? We think we're relaxed, but not necessarily. So oftentimes after Feldenkrais sessions, people have that true feeling of deep relaxation where their muscles really let go. And it's usually at that point when I'm giving hands-on sessions that people just completely pass out. And I actually let people sleep on my table. I just started doing this, letting people sleep for like 5 minutes on my table or 10 minutes. And when they wake up, I feel like they had this rejuvenating, deep sleep that's really helpful in their healing process. Okay, so now let's go to the thumb. So let's go ahead and do the same thing with the thumb. Now as you're doing the thumb, it's a little bit of a different movement because you're actually going to be more on the side. So very small back and forth. And notice how your arm wants to move, if it wants to go more in like that supination, pronation kind of direction. So it's kind of like the tip lateral side of your thumb, very small. And what parts of your body are involved in this motion of your thumb? And what happens to the arches of your hand as you move your thumb slightly back and forth? Fall asleep before my sessions are over. Actually, most people. And you know what? They're still getting the healing no matter what. Everybody stop and take a rest. And as you're resting, feel what the size of your hand is in your perception. Perception's a very interesting term. What's the size of your right hand versus your left in your perception? You know, we think our perception is our reality. It's like Alice through the looking glass. Is what we're perceiving real? Is my hand that I'm working with actually bigger? Or am I just perceiving it that way? And very gently roll your head once to the right and once to your left and see if there's a difference. And see if there's starting to become a difference in how that arm is lying, the contact that arm is making with the ground, especially versus the other one. Great. Okay. We're going to go back to our index finger of that same hand. Okay. So your index finger of that same hand, what I want you to do is I want you to start to make a circle with the tip of your finger on the ground. Make a circle with the tip of the finger on the ground. Make it small and see if you can isolate the movement to just that finger. I'm going to come around and I'm going to do it for some of you so that you can actually feel the most easy trajectory, the most easy way to do this circle. Make sure you're breathing, everybody. And make a circle the other way. What parts of your hand, what parts of your arm are involved in the circle? Pause for a moment. And now I'd like you to, with the same finger, the index finger, slide it back towards your palm. And as you slide it a little bit further towards your palm than you did initially, feel how your arches come away from the ground. And then as you elongate your finger, what happens in your arm? How does it move as you slide your finger back? Notice what happens to your wrist and your palm. And as you slide it away, notice how your hand comes more in contact with the ground. And there's a shift, a rotational shift in your entire arm that occurs. Do this several times. And if it feels really easy and effortless, you could go a little bit further, sliding it away and back towards. Now, how high up your arm do you feel this motion occurring? Do you feel it up to your elbow? Do you feel it up to your shoulder? And most importantly, do you feel it all the way to your shoulder blade? Just take a moment and listen to your shoulder blade as it makes contact with the floor. So the floor gives us proprioceptive input as to how our body parts are moving in space and what the connection is. So you might notice, is there a connection between the movement of your index finger and your upper arm, your shoulder blade, and your neck region? Okay, take a break. Pause. And now find your third finger, your middle finger. And let's start by making a little circle with the middle finger on the blanket. Now see if you can isolate it just to that finger. Because I see some of you guys are moving your whole arm or hand, but we'll differentiate the movement. Differentiate is a word that's used frequently in Feldenkrais, where you isolate the individual movement and teach it how to move in separation from the other muscles that are surrounding it. So go as small and as slow as the quality is really good. And if the quality is really good, you could go faster and you could go bigger, but not until the quality is good. Good. And make sure you're not straightening your fingers too much. Make sure you're welcoming the curves of your hand and the 3 curves of your finger. So there's 3 joints in the finger, like I said. And for these movements, all 3 joints needs to be involved. Okay, take a pause. So as you bring your finger back towards your palm, what that means is all 3 joints of your finger slightly bend, and your wrist may even slightly bend back. And as you elongate that 3rd middle finger, you can go ahead and do it now, away, there's a slight lengthening of your entire arm, from your finger, your wrist. Keeping that finger in contact with the ground. As you lengthen your finger away, see how much of your arm you can feel lengthening away. Listen what's going on underneath your shoulder blade. Okay, pause. Let's go to the ring finger. And with the tip of the ring finger, go ahead and make sure the tip is in contact with the ground to begin with. And then let's go ahead and make a very small circle. And once again, you're making sure that it's a very individual movement from the other fingers. And pay attention once again to the sensation underneath your finger, because you might have a heightened sensation right now. Like more nerve endings are awakened in this area. This is exactly what we do in clinic when somebody has a numb finger, or even if they have hypersensitivity in their finger. We'll have them rub their fingers or their hand through different materials, different textures, to awaken the nerve endings. So this one's a hard one to make a very little bit of a circle. So some of you may be working a little bit harder than you need to. And usually when people work harder than they need to, they tend to straighten their fingers, as opposed to maintaining the C shape of the finger. I actually think this is a necessary lesson for all people who are suffering with carpal tunnel and all those other hand repetitive use injuries, to do this lesson to retrain their hand how to move more wisely. So for some of you, you're contracting in your palm, and I'm speaking to you if you're one of those that keeps your palm flat more than you need to, and you just don't have the tools yet to know how to soften this area. So now take that finger forward and back. So as the finger slides backwards, the arches curl away from the ground. And as it elongates, there's a slight elongation of the entire arm, but not from the shoulder. It's only the finger. The finger is the motor for this lesson. Remember to take a break anytime you want. Notice some sensation. Notice what's going on under your shoulder blade. And notice if you could let go of the muscle tension in your hands even more. If you're one of those harder, better, faster kind of people, type hard, hold the pencil hard, they go softer. Softer, softer, softer. And then very gently start to take that index finger back a little bit further, the ring finger, back a little bit further, and see if you can almost slide it just ever so slightly under your palm, but just a tiny bit. I want you to try to figure out what needs to happen in your hand, in your wrist, in your arm. How does it best organize itself? So we need to allow our larger muscle groups to carry the weight of the smaller muscle groups. And allow that finger going to elongate even more. And as you elongate that finger, allow it to flatten the palm. Now see if you can allow the palm flattening to lengthen your finger even more, but without a lot of muscle effort. How can you use your palm, your wrist, to elongate that finger? As if I was standing away from you and I was gently pulling that finger away from you, which I'm going to do for a few of you. I'm going to pull the finger away, and then you're going to bring it back. And remember, if your breathing is free and flowing really openly, that means you're most likely doing it correctly. Correctly per your body, not correctly per my definition. Every body has a different, yummy yes state. When they're in the zone. So imagine someone's pulling that finger away and then bringing it back towards. So you can make it a little bit bigger as long as it's easy and you're not hyperextending your fingers and you're not holding your breath. Ooh, so you lifted your finger off, so you want to make sure to not lift it off as well. So the finger stays in contact with the ground the whole, take a full rest, full complete rest. So we're going to do a one-sided lesson right now so you can really feel the differences in both sides of your body. And then in the second half, we're going to make you symmetrical, so not to worry. Because the truth is for any movement, especially with our hand, it involves our whole body. So for this one, we're focusing on the upper body. So once again, let's draw that imaginary line from the back of your head, down your neck. Notice how your back of your head and how your neck is now making contact with the ground. Notice how your eyes and your nose are veering, if they're veering more to one side or the other right now. Notice how your shoulder blade is making contact with the ground, the side we just worked on. And how the breathing is on that side, the rib expansion. How about your low back, if that's changed shape? And how about the lightness in your arm? In the right versus the left side? And the lightness in your leg, is there any difference between the right and the left side? Now I want you to imagine that you have a pen in your dominant hand and you're going to write out in front of you. I know you're lying down, but you're going to pretend like there's an imaginary piece of paper right out in front of you. So I want you to go ahead and take that pen and go ahead and write your name or write whatever you would like on that imaginary piece of paper out in front of you. And as you're writing, I want you to actually really feel how much of your body is involved with this motion. What part of yourself is doing the writing? Is it your hand? Is it your wrist? Is it your shoulder? Is it your back? How much of yourself is actually doing the writing? You could actually do the writing anywhere. You could do it while you're on the ground, where you are. And notice how much of your low back you could feel involved in this motion. Okay, let that arm go, let it take a rest. Once again, notice your perception of the size of that body part, your arm. And very lightly and gently, let your left arm levitate up to the ground, up off the ground, towards the ceiling. And notice how heavy and how easy it is to raise it up. Notice what parts of yourself are involved in this raising up. and then lower it back down. And then switch sides to your right arm. As you raise it up, notice what's different. Does it feel lighter or heavier? And what is the difference in the back or the spine? Come back down. And notice what's the difference in the side of your face on the right versus the left. In a moment, I'm going to ask you to open your eyes, but not quite yet. But when you do, you might notice that there's more openness on the side that we just worked on. And you know, if you're a computer user, you know how your vision gets very narrow. So this is just one way to open up your peripheral vision. So I'd like you to go ahead and bend your knees and go ahead and move the bolster away. And stay on your feet for a moment. And I'll go ahead and balance you out just a little bit. So have your feet about hips width apart. And let's do a very gentle pelvic tilt. What that is you push very lightly through your feet, just enough to roll up the tailbone, your back flattens, and then you release. So gently push through your feet, just enough to roll your tailbone up, and your back flattens towards the ground. And as you release, your back gently arches away from the ground. So do this several times, and as you're doing this, you might notice that there's actually a difference in how it feels on the right versus the left side. Just explore the differences. So because this is a symmetrical activity, this is actually realigning the hemispheres of your brain, which realigns both sides of your body. So do about 3 more pelvic tilts. This is also getting your spine more connected with your arm that we just worked with. And let's go ahead and stop. And when you're ready, go ahead and roll to the right side. And when you're ready, using both arms and your pelvis, push yourself up. Your head comes up last. So go ahead and push yourself up to sitting. And go ahead and grab your bolster and just sit on your bolster for a moment. And we're just going to imagine that we're writing on a piece of paper. So just imagine that you have your pen in your hand and your piece of paper is out in front of you. And go ahead and write your name. And I want you now to listen for what part of myself is involved with this motion of writing my name. And who's got an answer?
Just my hand.
Okay, who else?
It's a lot more than that.
Yeah. Yes, great. So I'd like everybody to come up to standing, and you're in a little bit of, I call it the Feldenkrais trance. So it's okay, stay in this motion, in this state, just keep still and quiet inside. And I know it's a little bit crowded here, but I'd like you to go for a little walk around the room. Actually, hold on, just stop and standing. As you're standing, you might actually notice some differences. Notice which arm is longer. Notice if one shoulder feels lower than the other. Notice what's the difference on the weight between your right foot and your left foot. Notice what's the difference in your balance between your right foot and your left foot. If one feels more stable, the side we just worked on feels more stable, as in your body's more organized over the side we just worked on. And go ahead and you can do this with your eyes open or shut, but look over your right shoulder and then look over your left shoulder and see if there's a difference. Great. And then with your right arm, go ahead and reach your right arm forward and feel the connection through all the way to your foot. Good. And do the other side and see how less organized the side we didn't do is. But if we do this a few times, what happens is there's projection fibers in our brain that crosses the new information over. So the other side learns very, very, very fast. Okay, everybody go for a walk around the room and we're gonna take a 10-minute break. So if you need to use the bathroom, go ahead.